So people with congenital adrenal hyperplasia should have two very important things. You should always have a medical alert bracelet in case you're unresponsive. Then at least the paramedics or somebody who can help you will know that you have this condition. If you are still able to respond, or if you can get somebody else to do it for you, you have an emergency kit. In my emergency kit, I keep a 5-page instruction booklet on how to administer the Solu-cortef shot, as well as I have a letter that my endocrinologist gave me, basically stating that when I go to the ER, I have to be seen right away because I'm a priority patient and they have to get hydrocortef in my body through IV. Basically, it's 50 milligrams of IV hydrocortef, every 6 hours until I can consume my medication orally again. But before I go to the hospital, I have to administer a shot first. And if I can't do it, somebody else will have to do it for me. So my emergency kit consists of the vial of medication, a 23 gauge needle and syringe, an alcohol swab, and an 18 gauge needle. So basically what you would do is just wash your hands, and then if you have gloves, put gloves on. Make sure that your thigh, because you have to get it in right in that area. So once you're nice and clean and everything's prepared, you're going to open up your medicine vial. I'm not going to activate it though, but I'm just going to demonstrate to you what it is. So on the bottom, it's just a powder, and then on the top is a liquid. So what you have to do is you have to push hard down onto the very top, and then with the pressure, it's going to take that little rubber stopper and it's going to drop down into where the powder is. And then when that drops down, the water or the saline solution is also going to drop down. And you have to swish it in a swirling motion like that until it becomes completely clear. Then you take your 18 gauge needle and you put it on your syringe. Then you're going to attach it and take the safety cap off, and then now you would take that little yellow part off. For me, I need, what do I need? 1 milliliter, which would be 50 milligrams of Solu-cortef. So you drop 1 millimeter of air, and then you would stick it in to the vial. Up there's a little dot that you peel off. Looks almost exactly the same as that stopper there. And you're going to just push the air into the bottle. And after you push the air into the bottle, you then take this 23 gauge needle out, or sorry, 18 gauge needle, and you attach the 23 gauge needle onto the syringe. And then you put the needle into the top, and then you push all the air into it, because if you don't put air into this, it's not going to come out properly. It's just going to dribble. But you want to fill the syringe up to, well, in my case, up to the 1 milliliter mark. Then once you get that, still make sure that's nice and clean. And then you take it, you're going to want to flick it, make sure there's no air bubbles or anything. And then you just take it and you just stab it in your leg like a dart, and then you just, not too fast but not too slow, just put it in your leg and just inject it. And then after that, they recommend you just go straight to the ER, and that's about it. It's not too complicated. I myself have not given myself a shot yet because I haven't needed it, but I know how to do it just in case I ever am in a crisis and I have to do it and there's no one else around. I hope this video was helpful because I haven't found a whole lot of videos on how to properly use Solu-cortef. I found one video on YouTube, so I guess here's a second one. So if anyone needs any help or has any questions, please feel free to leave a message or comment down below, and I will be more than happy to, try to help you out with any questions you have, or if you're scared or something and just want someone to talk to and need support, I'm here for you. You can do it. It's okay.